Inagay, and welcome to a special Reconciliation Week episode of HeartKids from the Heart. My name is Angela Webb. I'm a proud Gumbaynggirr Jaeger woman from the mid-north coast of New South Wales and the Aboriginal and Torres Strait Islander Community Engagement Manager at HeartKids. Recently, I had the privilege of sitting down for a yarn with two incredible women who are making a real difference to the health of our communities in Far North Queensland. Tanika Parker, RHD Nurse Navigator for the Torres and Cape Hospital and Health Service, and Genavie Tabuai, Health Worker Coordinator for the Maternal, Child and Family Health Programs. I'd like to begin by acknowledging the traditional owners, custodians of the lands, seas and communities across Australia, and pay my respects to elders past and present. I also want to acknowledge any Aboriginal and Torres Strait Islander peoples listening today. Welcome, ladies. It's so deadly having you on. I know you're both so busy, so really appreciate that you've been able to jump on and give us your time. I might start off with just asking you, please tell us a little bit about yourselves, who you are, who's your mob, and what's your role with Torres and Cape Hospital and Health Service. Tamika, I might just start with you.
Yep. Thank you, Angela. And thank you, HeartKids, for having us here. I think this is a great opportunity for not only showcasing the roles that we do, but also what Cape York and Torres Strait are doing too. I am the rheumatic heart disease nurse navigator for Cape and Torres. I am a Gulki Bama, which resides in Hopevale. It's a little Indigenous community north of Cairns. Currently, we're based in Cairns at the moment. We're an outreach service. But yes, it's one thing to be born and bred and to be servicing your people. It's a big honor, but more of an honor to be working with deadly people like sister over here.
Thank you, Tanika. Jen, do you want to tell us a little bit about yourself?
Yeah, thanks, Angela. Thanks, Tanika. Yeah, so my name is Genavie Tabuai. I was born and raised in Cairns, but I've got connections to up in the Torres Straits, to Murray Island and Musig, and also to Daly River in the Northern Territory. But yeah, Cairns is home for me. I've grown up here my whole life. I guess I sort of stepped into the health worker space probably about 8 years ago as an advanced health worker, predominantly worked in chronic disease and then moved into a different area in the mums and bubs space. And sort of, I think when you're working in the mums and bubs area, you're able to provide that early intervention, sort of prevention health promotion from a maternal perspective. So, yeah, so I've really enjoyed being in the mums and bubs space. And then, yeah, as Sis here mentioned, being able to, it's definitely a privilege and an honor to be able to give back to the remote areas of where we live, which is Far North Queensland, being able to give back to the mob up there that are in remote areas to also overcome the challenges and support them through that to access, proper equitable healthcare. Yeah.
Yep. No, exactly. And I think you're right. You don't realise the distances and the proximity to different services and how challenging it is for people to come off country and to get to those services. The remoteness, as you say, is just massive. So, yeah, you're doing such an amazing job within communities. Tanika, tell us a little bit about you. How'd you get into your role as well as the RHD Navigator nurse?
I'm still asking that question today, just quietly. It sort of came about. I was just tapped on the shoulder to apply for the position. So I'm a registered trauma nurse by trade. Prior to this, I did a bit of ED work and just working with trauma patients, so head injuries, spinal injuries, stuff like that. This position came about. I was working with youth in Yarrabah, which is a little community south of Cairns. We were running a program called Young Person's Check, which also included rheumatic heart disease follow-ups and recalls too. So I was doing a lot of youth stuff there. It was targeted youth promotion and education and primary health. So that got me interested in around the rheumatic heart disease stuff. And then, fast forward to last year, April, I was successful for this position. And let me tell you, it feels like it's been 10 years. The stuff that you're exposed to from this role gives you a lot of insights and a lot of solution-based stuff that could help our mob. which is not only clinically appropriate, but also culturally appropriate.
Mm.
So it's been very interesting navigating through this sort of field, and how do we integrate as Indigenous clinicians, how do we integrate both of those skills when servicing our mob? So that's a bit of a background. I'm still very much learning how to service our community while stepping in both worlds. But predominantly, I feel like I'm in this position to service our mob. So whether that's giving them a voice about their health literacy, about their chronic disease, stuff like that, I think that's my passion, is now slowly drifting towards more the primary health, preventative sort of stuff, public health. I'm also finishing a master's in public health. So I really wanted to infiltrate the public health sector and public health diseases, because I've been dealing with just trauma incidences and injuries. So yeah, just trying to align with that, but very much still learning. And yeah,
coming into that role and dealing with all those different communities, remote communities, and just having all the transient communities coming into Cairns as well. I think walking in those two worlds of having your community hats on, you work under a department, so navigating all that space, there's so much that you have to deal with, the white man's world plus the Aboriginal Torres Strait Islander world. So it is a difficult task. There's so many different communities, and you can't just target one community. You put the one brush for all onto one community. They have very different needs and different protocols within those communities.
The other thing is too, which I think which would be a good opportunity to educate Australia too, there is a big difference between Cape York communities and the Torres Strait. Very, very different. And it also plays out in healthcare and culture too. So I'm also learning the Torres Strait side of things. I went to boarding school with a lot of mob, but since coming back home, there's a lot of stuff I didn't know too. So that's been very humbling, good ways. But yeah, there is a massive difference. I mean, kinship wise and whatnot is similar, but there is cultural difference.
Yeah. So with Yarrabah, that project you worked on, and so that sort of was the start of looking at RHD, and that project just, I suppose, focusing on the teens in that community. What were some of the main challenges and barriers that you found within the community accessing healthcare, the healthcare that they needed?
From a nurse navigation point of view, from my role now, working back in
Yarrie.
Oh, okay. So it's very different too, because Yarrie is only about 45 minutes outside of Cairns. Whereas some of our Cape communities, I mean, we're talking 2,000 Ks away, you know, from anything really. So there's a bit of a difference in terms of access and resources too. And if it's wet season, some communities are cut off. So it's very hard for them to get resources in. So there's a little bit of a difference around that. However, I think these are all collective challenges we face, but it was hard when non-Indigenous staff came from down south and they didn't really have a good understanding of our communities and the way we work and the cultural hierarchy too. And we found there was a lot of pushback with some of those staff in trying to integrate our cultural safety protocols. So that's challenging, because then, you know, we lose engagement with our kids, and this is all a collective stuff. So that was all the same. What I did find different and was allowed to do, and there's a bit of a difference because it was an AMS, it wasn't a Queensland Health. So I felt like we could integrate a lot of cultural appropriate protocols and practices. For example, it's not really RHD related, but around sexual health, when screening our kids, they dictated where they wanted treatment. They dictated they dictated it all. And we had 100% recourse. We were able to get them seen, treated, and then gone within 2 weeks. So, that's from 16 to 23. So that age group is very, very hard to target, especially around sexual health. But I love the integration of our own way, and our kids felt safe enough to dictate where and when. So that was a good highlight.
So Jen, could you tell me a little bit about the benefits that you've been seeing in community, just around the work you're specifically doing?
So at the moment, I am the program coordinator for maternal child health outreach and midwifery navigation, which are two separate services, but they integrate as well. because with midwifery navigation, we've got the pregnant women come down from Cape York, NPA and the Torres Straits. They come down to have their babies and to access tertiary services here. And then attached to that, we've got our child health outreach service. It is such a massive model and a big area to cover, but a very needed and rewarding area as well, I think. Yeah, so pretty much, I guess the benefits so I'm the program coordinator for that, the health worker program coordinator. And the benefits I see with our health workers contributing to that is providing health promotion on skin health in midwifery navigation to the pregnant women, and also in outreach where they're providing that additional skin health to our mums and bubs in community. So yeah, so that's the benefits that I see in this space. I guess like from a health worker point of view, but I think any sort of clinician can relate to this. Health promotion is never ending, and it's such a vital aspect working in health, is that how do we plant these seeds and water them for that knowledge to grow. And you don't know what you don't know. That's what I always say. But once you know, you feel confident to be able to manage, So health promotion's never ending. And I think it's everyone's business in health.
Yes.
Although with our health workers, seeing them provide prevention, I guess, health promotion prevention on skin health. So I guess providing that, and then the way they provide that is in a way where they do one-on-one health promotion with mum, and they talk about skin health strategies and steps, and then leading to that, they will go on to talk about if you I guess what's the word, the repercussions if you don't manage skin health now, and how that can turn into acute rheumatic fever and rheumatic heart disease.
Yeah.
And also just really spreading that awareness as well, because it's become so prevalent now. And I think the conversation with rheumatic heart disease and acute rheumatic fever, the conversation is starting more now, and, within our mob. And, particularly in remote areas, there's additional factors in remote areas. I think that's why the RHD disparity is so massive in remote areas. So we really try and provide that health promotion in the maternal child health space. And as I said, to provide that early intervention and prevention.
Yeah.
I find that when we do sort of the one-on-one health promotions, I find that the ladies that don't have RHD or acute rheumatic fever, they're still aware of it. So there are some that are aware of that. And again, it comes back to that conversation that has been happening, which is really good to see. And again, with our health workers and all the other clinicians, planting those seeds and just really watering it with knowledge, and really supporting the women and families.
Yeah, especially with the young mums, any mum really, just to, as you say, that promotion. But I think in our communities, it's like getting those nans in, the dads and all the family being aware of it. I know that that's something that it just extends further. And it's about supporting that mum to be the best mum she can possibly be, and giving her all the knowledge she needs to stop RHD and RH. That's so great. And so tell me about some of the real challenges and barriers that you see in community, and how do you overcome them from your perspective, and what can you do, I suppose, from the departments? Because, I know you work closely with the Aboriginal Medical Services, and I know all those other ACOs and different health providers, but from your situation being within the department, what are some of the barriers and challenges you see?
Okay. Yeah, so probably from a maternal child health perspective, I guess to give some examples is probably I'm just thinking coordinating the LA bicillins for the RHD clients when they come down.
Oh, yeah.
So some of the ladies come down and, as soon as they get referred into midwifery navigation, so they're referred to us antenatally into midwifery navigation, and then they've got to come down and have their bubba down here at 36 weeks, which they're away from country, away from home, and then having to access the services on the ground in Cairns, which is quite frightening and quite challenging. So as soon as we get their referral into that space, and knowing that they're a RHD client, is coordinating that and really communicating with the clinician back, or communicating with the referrer, which is a clinician back at home, saying, hey, when was the last time? Usually they write it on the referral as well when they're due for their next insulin shot. So we're able to pick that up and coordinate that. We do have some really close connections with a couple of the NGOs here in Cairns where they're more culturally appropriate and culturally safe. So myself and Tanika would use that same service. So we're able to coordinate their LA bicillins to that service to get them done down here.
Yep.
Probably one of the challenges I sort of find is that one of them I can think of is probably, I guess, coordinating that on their behalf, but also the health literacy and the understanding on why it's important. Because again, when it comes down to a first-time mum and she's newly diagnosed and she's not knowing the importance of having that done and the symptoms if she does, like the symptoms that can occur if she doesn't get that LA bicillin. So again, it's just reiterating the message and the non-stop education and empowering her to make those informed decisions to have it done here. And really wrapping around her with that culturally safe support and service to have it done here. I'm glad because obviously like with the mainstream services in Cairns here and like with the mainstream services in Cairns and the tertiary services here aren't always safe for our mob to access. So by overcoming that, where we've got that robust relationship with one of the NGOs I can think of, that is a health and accommodation service for the ladies from up Cape York and the Torres Straits. Yeah, so that's sort of where we overcome that barriers, providing that culturally safe wraparound whilst the ladies come down, providing that support and education and really trying to make that journey smooth as possible.
Yeah. Oh, that's deadly. And so, Tanika, what are some of the deadly programs happening in the Cape and Torres Strait? And what's been working well that you know of?
From my point of view, I think there could be a bit more. However, Jen and her team run a great program around skin health, and I can let Sister here talk to that. But in terms of the adult stuff, if I'm being quite frank, we need to do a bit better. We do have skin health programs in our schools and whatnot, but from what I have seen, it's not really consistent because of the dynamics within our communities and availabilities of these services and whatnot. There's a very layered complexity around this and our delivery of care. We do work very closely with the public health sector, so that they're the main ones that run the skin health programs in our communities. But I have found it's a bit different. It's a bit different in terms of promotional health. When I was younger, growing up in community, we had a very general knowledge about, sexual health, lubalicious, all of that, oral health, clean your teeth and stuff, skincare. Like it was very general, but we knew. Whereas I'm finding this generation coming through now, they just don't have that. They don't have the general. And there's no, I feel our mob would, I would always ask questions. Why are you doing that? Why is my nanny taking this? How come she's having that? And that's how we learnt. So I'm finding we just don't have that at the moment for whatever reason. Maybe it's the political landscape or them kind of stuff. But I'm finding there maybe needs to be a bit more.
Yeah.
But programs that we do have at the moment, I mean, they are making a good effect. We are increasing the health literacy around promotional and preventative health. Like all, I think it could be a bit better. My patients, they must hate me, but I quiz them. So either if they're on the tail end of me discharging them, or if it's at the start, I'll ask them the same 3 questions and then ask them again when they're finished. And I know when they roll their eyes and, they're a bit sassy, they're right then. That tells me you don't even need to answer the question. I already know you're right. So keeping it a bit lighthearted too, because it's quite heavy stuff, especially mobs that have the valve surgery and stuff like that. The more fun you make it, the more engaged they are. And me too, really.
Tell me what those 3 questions are. You ask them.
So what is rheumatic heart disease? Just tell me about it. What is it? And what's the difference with ARF? And then the other question is, when you have skin sores, what can you get? And how do you clean it? But it just depends too. Like if their health literacy is really low, we'll go back to the basics. Oral health, skin health, very basic stuff. If I get a family member that has a lot of family members that have rheumatic heart, I find that they know the basics. It's just enforcing it. And then enabling them to be the advocate for their family. And
Yeah.
sometimes some of these kids are, 12, they're quite young.
Yeah.
But I do have a good news story. Just
Well,
going to
tell
chuck
me.
it out there. Just one of my younger patients in the Cape, he's a 14-year-old. He needs to be on Bisolin for the next 3 years. But I got a message from a health worker from another PHC that's not within our catchment. And he messaged the health worker saying, "Hey, my Bisolin's due this week. Can I come in on Monday?" And I was like,
he
"Oh
did
my
it
God,
himself.
14. He's organized it
Oh.
himself. He didn't want it the day he said he would because he had fishing, but he came in the next day and he had it. Priorities.
Oh,
I know. 14. And me and him have been, oh my God, he
what is
has
that?
toes. So
That's cute.
it's stuff like that. That's like, that's
Yeah.
life, isn't it?
Just that, knowing that they're listening, they're changing, they can hear it, and it's empowering,
Yeah.
to see that. Yeah.
It is.
Yeah.
It is
Oh, that's amazing. And just to your point, I think you're so right with when it comes to RHD, just with some of the communities that I've spoken to just in the Pilbara, there's a big community outside of Karratha, Broburn. And I ended up talking to a couple of the mob there and we started yarning and they said, oh, well, the grandson, he's going in to see the doctors, the pediatrician, because he's got RHD and he's going in for his checkup. And then grandma was there and she said, I've got a heart condition as well. And grandfather, it turned out that he is too. And when I said RHD, they knew all about it. They knew, how it starts, how the prevention side, all ARF and that. So, yeah, those questions are, it's about just reiterating it all the time, and checking in and making sure they're understanding that. So it's, yeah. So, ladies, if you had a magic wand, what would you ask for regarding the issues in communities and their health?
I was just talking to Jen about this. We're going to be here all day. If we really wanted to, give you a wish list, but just thinking on the top of my head, for me, I think it's 3 things. Look, there's a lot of discrepancies around servicing our mob, and there's a lot of layers of it. But one thing I would definitely change is we have a state policy currently for patient travel. And unfortunately, dental isn't supported on patient travel. So we're getting RHD clients getting worked up for valve surgery that are needing, and because it's not under patient travel, they have to get their own way here, which isn't a $50 flight,
No.
and it's usually quite a process to travel. So we're finding a lot of that. I would change that in a heartbeat. The second thing I would do would be empowering our communities to come up with their own programs and advocating for them to stick in their communities. The last thing, and I think we share the same thing, would be upskilling our young ones, bringing them through. Upskilling, getting them prepared and getting them all voiced up and ready to advocate too, but pretty much making a path for our young ones to come through.
Yeah.
And probably an endless supply of seafood, but beggars can't. Yeah. Anyway, but I'll just settle with those 3.
That's deadly. What about you? Have you got anything to add, Jen?
Yeah, definitely. I think, Sis covered it there in a nutshell. I'd really like to point out back to community needs and, really being able to, like, as we discussed earlier on in this, each community is different, having their own distinguished cultural backgrounds and protocols, and also health needs as well. Like, we're not all in the one box as well.
Yeah.
And coming back to understanding the disparity in the health needs of Aboriginal and Torres Strait Islander. We're not all in the one box. So I think recognizing that, and like Sis said here, valuing that and valuing each community and being able to give them the mob their voices to speak up on what they want and what they need in their community. I think that's really important, is having that real community-centered approach. I think another thing would probably be awesome as well is probably, again, I think you touched on it a bit too, is that grassroots collaboration. So having a bit more of that collaboration, steering forward for, I guess, steering towards that same vision and goal on how we can tackle the disparities and issues of health in each community. So I think that's really important too, because I think it can't come down to one person's responsibility. I think it comes down to all the players need to come to the table. And I think it needs to be a moving force with the whole collaboration from a grassroots perspective. And in saying that, when I say that, I mean by allowing the communities to drive that. You know, we come to their table.
I think you're right. I think we have so many of our Aboriginal communities, the services coming into them, and there's things that overlap, and then there's different government agencies coming in and doing different things. And it's just so overwhelming at times, It's about how can we coordinate and have a mapping system of who's doing what. Providing what? Who's providing this role? Who's providing these services to community? And then working together, as you say, and collaborating on things instead of overlapping or stepping on people's feet. Some services think that you're stepping on their feet or you're coming into their little patch. They don't want that, I know here just in my community, you've got to say, no, we're trying to provide this service for the mob, and the more they get this information, the more empowering they're going to be and know about what's out there for them and what services are available. So let's coordinate that in a better way. Definitely. I agree. It's a big challenge. I think that's everywhere too. Everywhere you go, every community, they're all saying the same thing.
I think too, like when we think about all coming together, I don't think it should be just the players of health. I think it should be the players of
straight up.
That's right. And that's what I was, that's what I mean.
Our health too, because whatever's with the social determinants outside of health, that impacts health for our people. So it's trying to really, I think it's not just a health issue. It's looking outside of that and looking, all right, what are the social determinants? How can we overcome those challenges? And I think it's bringing everyone to the table, from education, from housing. From employment. And, I think that's the way. If I had a magic wand, I'd really like to bring those type of players too, like not just health.
But there's so many of the services like housing, it's the health, it's our education piece, it's all those social determinants, and bringing them all together and saying, this is what this community needs. They need more housing. They need more houses built here. How can we stop the overcrowding? Let's build more houses. What do you see, HeartKids? How can we better support youth fellas? I get Tanika a lot and we're meeting quite a bit. We're looking at our resources. We're working on our RHD animation at the moment. Is there anything else that we can be doing better, providing youth as a service?
I would probably like, from a maternal child health perspective, I would probably like, I guess, sort of more workshops for our health workers. I know, like, obviously I mentioned before, like our health workers are providing that one-on-one health promotion education, and they are doing group activities as well. So health promotion programs in outreach as well. But I would like a bit more informal support to the health workers on how they can upskill. I don't want to put that load on Tanika being a RHD nurse navigator. I don't want to put that load on her to be able to do that. I would prefer, like, if you guys can offer that support, whether it's workshops or whether it's monthly catch-ups or quarterly catch-ups with our health workers and just touching base and seeing what's working well and what's not working, and how can you guys support the health workers better in that space, because I think there will always be constant changes as well. I think I would probably like that.
That would be amazing.
Perspective.
Yeah.
And I've got some resources as well off Tanika. Yeah. So they're the ones that we use. If you guys have any updated ones, catching up with us monthly or quarterly or something like that, and just touching base and seeing how the resource is going, or even if you guys need some consultation with our health workers from up this way that could probably speak on the behalf of, give that consultation feedback on how brochures can be worded or suited for up this way.
I love that.
So something like that.
I'm always going to Tanika, so there to have some other eyes.
And like they're like, we've got Tanika's cousin in Hopevale, and should be able to definitely provide some feedback, so, and if I can bring more players to the table that can help in that aspect to provide that feedback on if certain brochures can be worded like appropriately to
Yeah.
this area,
Yeah.
up
Oh.
this area, but up Cape York,
That's
NPM, the
true.
Torres Strait sort of area. I would love to be a part of that.
I would love that.
Yeah.
And,
Health
you know, we've got
worker
our RHD fact sheet that's nearly on the verge of being signed off. We've got brochures and the dental flyer as well that's been
Yeah.
updated. And then
Lovely.
we've got our RHD animation, and that's just the start. So, you know,
Yep.
we're looking at expanding all those resources,
Yeah.
and
That-
I'd love to build that relationship and connection up with all of you fellas. And I reckon we could do our own little yarning circle every month to
I
every
reckon
second
we
month,
could.
bi-monthly, where we can
Yep.
bring some of those specialists in too, getting them in to have a yarn with us
Yeah,
all. That'd be
sure.
awesome.
Yeah,
That-
for sure. I'd love that too, because
Yeah.
as I said, like that conversation, you know, is becoming very prevalent now. And
Yes.
if we can get everyone up to scratch in this sort of area as well, and the more we learn and the more we know as well in the RHD space, in upskilling others on in addition to that,
Mm.
it's able to filter out hopefully and really give
100%.
back.
We've got a bit of a bad stigma with the RHD at the moment, just with the 3 deaths in Doomadgee 2 years ago. Jen's onto it. I think if we put this in the hands of our health workers for promotion, they're our bread and butter in community. They don't get a day
Yes.
off. When they
Yes.
finish, so I think enabling them and empowering them up to take lead with this, hopefully other staff will follow. But
Yeah.
I wholeheartedly agree.
Yeah, look, I'm all for that. Whatever I can do, you know, we can keep coming together. We keep talking about it. I'm so excited, and I reckon it'll be amazing. Let's keep on it. With all of us focusing on that, let's make it happen.
From my point of view, just talking about going back to your question about how you guys have helped, I just need to highlight, and I think it's worth you guys getting a big thank you to the stuff that you sent up for the Pomperow Youth Summit. That went a long, long way. We had young kids that have never had socks before. It was quite touching, actually. And they were, little socks and just the bags and stuff, but it went a long way. You see them kids walking down Pomperow, I got a few photos sent to me. They got their fishing stuff in it. So they're using the bags and whatnot.
Yeah.
But I
Oh, that's so great.
it's a very, you guys contributed to community events and stuff like that. That's where our patients are, and that's where the vision needs to be. That's where you guys have now imprinted. The word has gone out, but I think them type of like supporting community events like that,
Yeah.
a long way.
Mm.
And it'll also
Yeah.
show, you're about the people, not just the PHC, you're about
Yes.
people in community. And I think
Yeah, we want to get our information out to all that grassroots, and the people, as you say, community. That's where we want to target. And yeah, we'll continue doing that. It's so important for us. And after we spoke, and you said that you'd seen them walking around with all the stuff, and they were so proud of that. And for us to be able to support that, have the opportunity to support that event, it was amazing. So
Yeah.
wherever we can, that's what we want to do.
we'll be putting our order in again this year.
Yeah, because I've reached out to the organisation as well to see if they needed anything.
And I can help you navigate that. I do like the idea of it going to the health workers. My job is just to link you up to all these mob. And then, so happy
Yeah.
with
Thank you. Well, listen, we've got to run. I just really appreciate your time, and it was such a good yarn. I really learned a lot from you, and it's been so interesting to hear what you are actually doing on the ground and out in those communities, and for those remote communities around Cairns. Look, I take my hat off to you. You've got a big job and big remit to fill, and you're making a difference. I'm so happy that we've connected, and it's been great.
Thank you.
Thanks, Angela.